I'm Stephanie Wolf. I'm here to go over some questions that you all have about hormone replacement therapy and why you would want to choose somebody like me, hormone specialist, over your general practitioner. So before I prescribe any medication, testosterone injections or pellets or any other hormones, I'm always going to want to get your blood work drawn. And the reason why is because I'm looking for baselines. You know, I want to see where your liver sits, your kidney sits, where your testosterone level sits, estrogen, progesterone. There's so many different things that go into it that I can't just, pick a number off the top of my head to go with treatment. So I have lots of patients who will send me over a copy of their blood work that perhaps they had done by their family practitioner. And while that's great, it does show me, liver and kidney, white blood count, and cholesterol. It doesn't give me a complete hormone profile. And when I say a complete hormone profile, what I'm looking for specifically for male is I want a free testosterone, I want total testosterone, I'm looking for estrogen, I'm looking for dihydrotestosterone, I'm looking for your PSA, I'm looking for an IGF-1, your luteinizing hormone. There's so many things that go into hormones. The way I always explain it to patients is it's like a symphony. You have different players playing and they all have to be playing at the same level in order for it to sound beautiful. So if I were to just give you guys a prescription, for testosterone or for pellets or for maybe peptides without checking lab work, I don't have a baseline. So I don't know where I'm going with my treatment or, what strength you need or what dosage you should be on. And so really it's me just treating you blindly, and that is not the way to do medicine. Some insurance companies will cover labs, some insurance companies don't, but the majority of them do not cover any of the treatment. So unfortunately, this is just the world we live in, and it is what it is. So once you call and speak with one of my specialists here, they will get all the information that I need to order your blood work, and they will actually help you schedule this appointment so that you can go in and get your blood work drawn the next day. All I ask is that you're fasting, that you go between 7 and 9 a.m. as this is when your hormones are at their peak, and just allow 5 to 7 days for these labs to come back. After those labs come back, then we get you into the schedule and you'll come in for your initial hormone consultation. So in my initial hormone consultation, it is a 90-minute consultation, and trust me, we are going to use all 90 minutes. You'll come in, I sit down with you, I go through your medical history. Not only am I going through your medical history, but I'm asking you lots of questions because these questions actually get me thinking about how I want to treat you or what I'm treating you for. What I'll tell patients is when I see your blood work, I have my own goals already in place for you. But I have to remember that this isn't about me, this is about you and your goals. So I'm here to kind of hear you, listen to you, figure out what you're looking to do. From there, I will then go into my hormone handbook, which is what I've created for you guys, and I'll guide you through what specifically I'm looking for. After that, I'll go through your entire lab panel with you. I sit down with you and I go through every little detail, telling you what you can do differently, how you can change this, what kind of treatments you can do. From there, I've created a custom plan. I'll go through the custom plan with you, and then at the very end, I'll do a complete physical. So it's a long, busy day, but there's so much information that you're gonna leave with. I guarantee that you'll be so happy. You can get started as soon as you'd like. Just go to novomail.com, fill out the form, and one of my specialists will reach out to you and get you started. So now that I've answered all of your questions, you could see why seeing a hormone specialist like me would get you better results than seeing a general practitioner. What I'll try to explain to patients is your general practitioner has a lot going on. They're seeing patients for diabetes and cholesterol, blood pressure, sinus infections, physicals. So they don't really have the time and energy to devote to hormone replacement therapy, whereas this is what I do. Day in and day out, I'm seeing hormones, I'm seeing you guys, I'm treating you. So really, you're gonna get the best results by coming to me.